Industries that are hot, sectors set to outperform the market. That's what's here in Zacks Industry Rank Analysis. Let's take another little peek behind the curtain, an interesting peek into another industry with Charles Rotblut, our senior market analyst here at Zacks.com. He puts this report together for us each week, and I tell you what, it never ceases to amaze me. Each week that we go down the road is more interesting than the one before. This week you're taking a look on your radar at healthcare providers. And this comes at a pretty interesting time with all of the discussion going on about healthcare in this country, possible nationalization, possible restrictions of various types. What's the news here?
Well, the news is good earnings, and really, if you look across the medical sector, there have been multiple companies that have good reports. We're seeing estimates being revised higher. The medical sector as a whole is the second best ranked sector, so there's a lot of positive revisions. Haven't really seen the stocks react that well, mostly because, in terms of the overall healthcare group, mostly because of fears about what's going on in Washington. But when you look particularly at these healthcare providers, very strong earnings. In a lot of cases, we saw double-digit growth in revenues and earnings. A lot of times we're seeing reports right now that where the numbers were just better than feared, and it's like, okay, you're surprised, but estimates were really cut. This is a case where these people really are having true growth, both revenue growth and earnings growth. Now, some of the growth, as I discussed in here, came from acquisitions, but some of it's actually organic, where the company's doing something internally to actually grow sales, whether it's enlarging its sales force, doing a better job marketing, providing a service that people need. But anyway you look at it, and I actually list earnings for 7 different companies. It was really a case where I started writing this, and I thought, well, I could kind of explain to people that the numbers are good, or I can say, here are the numbers, see for yourselves. And in this case, it's worth looking at the article because the numbers really are pretty impressive across the board.
You know, the healthcare industry, latest word I heard from them this week was that they are more than willing now to work with the current administration in Washington on curbing costs, coming up with some type of a plan which will help rein in costs in healthcare. But as somebody who looks at these industries from the financial perspective that you look at them with, does it concern you that the more industries have curbs placed on them, the more chance there is to contain corporate earnings of companies within those industry groups?
I don't. A lot of people, they look at regulation and go, oh my gosh, there's increased costs, we can't do this. But it's two sides to the coin. Where there's increased costs for one company, there's another company that needs to provide whatever is necessary to meet those regulations. So although you can be overburdened with regulations, I think there's also a lot of upside. And I think when you look at healthcare, it's not just the healthcare sector that everybody's focused on. You really have to look across the board. Right now, we're looking at healthcare being in the high teens. I think the number is about 17% of GDP. In the next 10 years, they're actually projecting that it'll be well over 20%, close to 25%. So we have a huge drag. There's a lot of inefficiencies, a lot of billing issues, a lot of problems in terms of how we provide care, mostly reacting instead of trying to do more preventative stuff. So I do think there's a lot of changes that could be made that overall will be very beneficial to the economy. The other thing, though, is when you look at the healthcare sector, and it's particularly healthcare providers, and some of the companies I mentioned in here provide this type of service, you have to look at the demographics of the U.S. We are getting older. That's going to mean more need for healthcare providers, more nurses, more doctors, more treatments. And certainly there's a shortage of doctors, a shortage of nurses. I saw today in the Wall Street Journal there's a shortage of lab technicians. All that needs to be addressed. But if you're in the business of providing care, that's actually a good thing for you because it means actually business should increase for you. And even on a situation where we had maybe some type of single payer situation or however the plan actually develops, it should long-term be good for these companies. Even if we see slightly lower margins, we should see an increase in business. So although the short term, as we look at the industry rank analysis, says it bodes pretty well for these companies, and certainly as there's some questions about how quickly the economy is moving towards stabilization, this gives investors a little bit more of a less economically sensitive sector. Long term, you got to look at the trends and realize they are very bullish for the medical sector. As I said, right now, there is some political risk, and I think anyone looking at trading the sector needs to realize that. However, I think any healthcare reform, if it does happen, is going to be very long and slow in the development. There's a lot of people who have interest in it. President Obama seems to be doing a very good job with reaching out. And as a result, while a lot of people like to see some type of resolution, it's definitely not something we're going to see over the short term. And as much talk as there is, it's still going to be a very big battle, and it's going to be very surprising if he gets something done before the end of his first term is up.
All right. And if you would like to check out those 7 companies that Charles outlines in this week's Industry Rank Analysis, by all means, go check it out at Zacks.com, especially if you're getting to this video outside of Zacks.com. You have to know that a lot of times with these pieces, there is text versions of articles that appear with them, and so this one in particular is interesting reading this week. Click on the headline under the Industry Rank Analysis banner, and it'll take you right to them, and you can look at those 7 companies on the list for yourself. With Charles Rotblatt, I'm Terry Ruffalo.